Okay, go ahead.
Okay. We are group 3. I'm Kelsey, and Hannah and Berkeley are here as well. We're going to be discussing accreditation of healthcare organizations today. So starting off, what is healthcare accreditation? The Accreditation Commission for Healthcare defines accreditation as a process of review that healthcare organizations participate in to demonstrate the ability to meet regulatory requirements and accreditation standards established by a recognized accreditation organization. To achieve accreditation, a healthcare agency must be evaluated to survey a variety of areas within the organization to be sure they are meeting required standards. This evaluation surveys things like organizational structure, policies and procedures, compliance with state and federal laws, quality of patient care, patient and employee safety, performance management, efficiency of financial management, and overall staff performance. So I'm going to turn it over to Hannah now.
And accreditation is not mandatory. It's all voluntary. Organizations, they can choose to be accredited or not. Even if they choose not to become accredited, they still have to follow state and federal rules. And it's not automatically renewed. It's a process they have to go through every time it, I guess, expires, that they need to reapply for every 3 years. And organizations become accredited so that they can prove to the patients and all those who go to help them understand that they have good quality management, that everything runs as smoothly as it possibly can, and it's professionally organized, recognized, and sets a higher standard for patients to be able to do all the things that they need to.
So there are 3 levels of accreditation. Full accreditation is granted when an organization meets all required standards and no corrective action plans are needed. Interim accreditation is authorized when a healthcare organization meets most of the required standards, but there are still some areas that need work or corrective action in order to be in full compliance. It's basically saying you're accredited contingent upon your ability to change these things and become 100% fully compliant. Interim accreditation cannot exceed 12 months, and if evaluations are performed that find a facility is still not in full compliance after that 12 months, they'll be denied accreditation. And then that brings us to the 3rd level, denial of accreditation, which is just like it sounds. It means the healthcare facility didn't meet any of the requirements and were therefore denied accreditation. And then passing it to Berkeley now.
So there's a process that goes along with getting accredited. So the application process, the healthcare organizations have to apply for this accreditation. And when they do that, they agree to abide by the standards that are set by the accrediting agency. And then there's an evaluation and survey portion. And this evaluates the organization, and that just makes sure that all the standards are being met within that organization. And then there's a decision process, and during that process, the evaluation is reviewed and a decision on the application is made. And then they have an accreditation status, and an organization will remain accredited as long as it continues to meet those required standards that are set by the agency. And then the organizations must be evaluated every few years to renew their accreditation status. And then there's differences between the accreditation and the board of certification, but there's also some similarities between the two. So when it comes to similarities, both are a voluntary process. An application must be submitted for both to happen as well. The documents commitment to the highest level of care within the facilities. They must meet certain standards or requirements. And then there's obviously tests and evaluations that must be passed in order to receive that accreditation or certification. And then as far as differences go between the two, certification is just for individuals, and then accreditation is for organizations. and a higher level of training and skills in addition to following the standards is needed.
And what the role is for the ISO in the accreditation process is ISO stands for International Organization of Standards, and it's not an accreditation agency. ISO 9000 is standard. It focuses on quality management. The ISO is responsible for the implementation of standards for a variety of business types and is not limited to healthcare. ISO 9000 standards are what the evaluation of healthcare organizations seeking accreditation is based on.
Okay, and for our last question, it was to interview someone in management at Madison Memorial Hospital and ask why they chose the ISO 9000 standards as their accrediting body. I wasn't able to get in touch with anyone, so I just did a little research on my own about the hospital, and from their website, I found that they are accredited by DNV, and found this quote. It says, in May 2001, we became the 13th hospital in the United States to be certified to the ISO 9001-2008 standards, and DNV has built their surveying process off the ISO standards. ISO is not an accreditation, it is a certification. ISO is all about continual improvement, and that is what we want our accreditation body helping us do. We recognize accreditation as a team effort and welcome the surveyors to help us identify noteworthy efforts, areas for improvement, and even corrective actions. Evaluating each of these areas will advance our organization from a good to a great. And Madison Memorial chose the certification of ISO 9000 standards because the idea behind these standards is continual improvement, and that's what they strive to do. I did a little more research on why other organizations might choose this over like the Joint Commission or something like that, but some things I found were it's a little bit cheaper to seek ISO certification, and it's more business-based, so it focuses on management and staff improvement more than patient care, or more than patient care, and it's a little less rigorous than something such as the Joint Commission for healthcare standards. So I think those are some of the reasons, and I found those off the ISO website that I put there down at the bottom too. So that's a great website for even more resources on ISO standards and what they are. But just to kind of recap, the ISO, I found this on their website as well. They give a really good definition of accreditation, and it says, accreditation is the formal recognition by an independent body, generally known as an accreditation body, that a certification body operates according to international standards. So that's kind of it. That's the end of our presentation.
All right, good work. You covered the topic really well. I mean, it's kind of an interesting topic if you think about it. People are paying all sorts of money to do something that's not mandatory. I always thought that was interesting, but it is that gold standard, I guess you could say, with the Joint Commission and also the ISO 9000 and the debt. I can't even say this very well. The debt Norski Veritas is, really good. It helps people understand. I mean, I know, thinking me personally, if I were to go to a hospital and one was accredited by an accrediting body and one was not, I would definitely go to the one that was accredited, just because they've gone through several rigorous tests and things like that. But so I ask at the end of each presentation, I ask the students all the same questions. So we'll just start with you, Kelsey, since you're unmuted right now, and then ask the rest in just a second. But what was the most interesting thing that you learned as you were studying this topic?
Well, I think the whole process of it, but then also the ISO 9000 standards, I had no idea what that even meant when I read that question. And then to know that it's not an accrediting agency, and like a company can't be certified by ISO. It's just a set of standards that people use. And so I don't know, it was interesting to me to see how the ISO standards fit in, and then again why people would choose that over something like the Joint Commission. So that was interesting to me.
Great. All right, Hannah, same question.
Something that I thought was really interesting was that accreditation is not mandatory. And so I just thought it was really interesting that people, like the organizations, go through so much so that they can be accredited, spend all that money on something that's not mandatory, like you said. I just thought that was probably the most interesting thing that I learned from this.
Yeah, it's a lot of money. I mean, even just to pay to be a member is a lot of money, but they also, the organization I work for, Intermountain Healthcare, we spend so much money just preparing for the Joint Commission surveyors to come in and do it. I mean, hundreds of thousands of dollars, I'm sure, every year just to make sure we're up to that standard. So, really interesting. All right. Berkeley, same question.
I think it's really interesting because I just had surgery this past Thursday, and so they put me to sleep, and my parents were in South Carolina, and I had this like pre-visit before, and that's when they told me I needed surgery. And so my parents were flying out here for this surgery, and they're like, tell me about this doctor. Like, we don't know anything. And so we started Googling, and it said like the Joint Commission, and I was reading all this stuff, and I was like, oh my goodness, I'm learning about all of this. And so that was really nice to be able to put 2 and 2 together there, and to just figure out like that accreditation and board certification is 2 different things, but to learn about the similarities and differences between the 2 as well, and like what it necessarily means if there's the Joint Commission for this like specific doctor, but then like just the whole process with how that works and the differences and similarities that go there.
Awesome. That's great that you were able to learn that.
Apply it to a real life setting.
That's great. All right, so I'm going to go ahead and stop recording, but hang on for just a second.